Good morning. I'm Shaw Perry, Communications Manager here at NJRHA. Today we have Kimberly Vander Warn, Vice President of Optum Healthcare. I'm saying that right? No.
Close,
correct.
so close.
I know it's United
Optum.
Health Optum.
United Health Group Optum.
Yes.
There we go. Good job, Shaw.
I am not great at this, but thank you. Welcome, Kimberly. Thank you for joining us. So tell us a little bit about you, and I will prepare our screen to be shared.
Okay. Thanks for dialing in this morning, everybody. Thank you for inviting me. We've had a wonderful partnership with NJRHA, Mary Lou. There we go. We see the presentation now. Okay. Shaw and the team for many years now. And okay, good. So you can't see me. Can you, Shaw? You can see the presentation.
We can see you.
Oh,
I can see you, so they should be able to see.
Okay. So welcome, everyone. The purpose of today's conversation is to talk about the partnership that United Health Group has with the hospitality industry, with NJRHA, and a variety of national, national hospitality associations, AHOA, HNLA, NRA, a variety of national associations, and then virtually all restaurant and lodging state associations and organizations. So the reason this started is because we United Health Group entered into a joint venture partnership in 2009 with the National Restaurant Association with the purpose of developing a platform to be able to offer differentiated members-only solutions that will two things are at the cornerstones of our platform and our offerings. One is it's got to be different. There has to be a differentiator. So it's got to be something that if someone is not a member of your association, they cannot get the special price or the special value add or what have you. And so that's how we support the member value with our association partners. And then as well, each one of the products generates revenue for NJRHA, our association partners, to help with staffing positions or whatever our partners want to do. So United Health Group is a parent company, and under United Health Group, there are two divisions. One is Optum, which is where I work, and that's the health services organization. And then there's United Healthcare, which is the health benefits arm. So we kind of have our finger on the pulse of everything going on from a health and wellness COVID perspective. And our goal is to support the hospitality industry, to create population health. The vast majority of folks in the industry have no access whatsoever to any health and wellness resources, anything at all. They don't have health benefits. They need help desperately. And so that's my job, is to find different solutions that I can negotiate differentiated offerings that NJRHA can offer to you and your employees as its members. Next slide, please. This gives you an idea of all of the different solutions we have for you and your employees as members of NJRHA. A whole bunch of different solutions, in addition to United Healthcare, medical, and other discounts. So we're going to go through each one of these. And please do stop if you have questions, please do stop and ask. So this is not a monologue. I'm very happy to have a dialogue. So in terms of what I do is I run this joint venture. My job is I run the joint venture along with the National Restaurant Association. I find and vet different product partners, negotiate deals, put together, develop the products so they're meaningful for you and your employees, and then work with all of our different association partners. We have about 65, 70 different association partners, all hospitality, and work with each one of them to really leverage what they do well. We really look to fit into their model of communication and how they want to, what their members need, and then we try to adapt to make sure that we're meeting their needs. Next slide, please. So the first thing we'll talk about is, especially because this is now the time of year where people are thinking about health benefits. Of course, people can buy employer, I'm talking about right now, employer-sponsored benefits. And despite the fact that about half of the organizations have a January 1st effective date, the rest of the 50% have effective dates all year long. So, but people do start really thinking about in earnest health benefits this time of year. Again, does not mean that if you're not doing it now, it doesn't mean you can't do it in February or July. Plenty of half of the businesses out there are mid-year businesses. Nonetheless, a lot of people thinking about it now, and so just want to briefly go through what United Healthcare has to offer to NJRHA members. And so really for all members, allied members, suppliers, it doesn't matter what business you're in, but as long as you're a member of the NJRHA, you have access to a variety of discounts, a variety of special products that are only available to you as members. And so if you have questions about that, I would ask you to talk to your health benefits broker. Talk to Amy Hathaway. Amy Hathaway, most of you know. I should have introduced Amy at the start. Amy, are you on? You're probably muted. Well, Amy Hathaway is your New Jersey expert. She's on my team, and she is she's a phenomenal partner. She'll take great care of you, and so and her information is at the end of this slide deck, and we'll certainly be happy to send it out to you. So contact Amy if you have any questions about any of these things. The one thing I'd like to read out is bullet point 2, and this is something that I wish more people took advantage of. This is what we call specialty discounts, specialty products, and that's vision, dental, life insurance, disability, critical illness. These are, so if you as an employer don't have the profit margin to subscribe to employer-sponsored benefits, there are ways that you can offer dental and vision with zero contribution. So if you wanted to offer with your contribution, it's very, very, very inexpensive. And you don't have to buy medical. You can just buy dental or just buy life. We've got some very large hospitality groups that only buy life insurance from us. You get a 5% discount, incredibly inexpensive compared to medical. And then as well, for vision and dental, you can actually get plans that employers don't have to contribute to at all. It's just the contribution is passed on to the employee. So much to offer there that's affordable. I would just ask you to reach out to Amy, and she'll be able to help you more with that if you have an interest. Oh, I wanted to add one more thing too, and this just happened, so I did not update this slide. So this is super exciting for us. I've been working on trying to put together a deal with to get members of the hospitality industry and our association partners access to specialized individual and family plans. So what we've been talking about thus far are employer-sponsored plans. So obviously, there are a lot of employers in the industry who just either can't afford to offer medical benefits, or there are employees who are full-time, who can't afford to participate in them, or for whatever reason, people don't have health benefits. So I'm delighted that we just struck a deal with United Health One, which is a separate segment in our organization that only sells individual and family plans. And that is super exciting because we're going to be able to offer you individual and family plans not only through United Healthcare, but through a variety of other carriers. And you can pass that on to your employees. So if they're interested, they can go online, plug in a little bit of information, and get a quote back from 3, 4, 5 different carriers. So very excited about that. I think that's going to really meet a need in the industry. So that's coming soon, I would imagine, January. Okay, next slide, please. Teladoc, our Teladoc partnership is, I think, what I'm probably the most excited about this year. So, as you know, virtual visits are the thing of now and the thing of the future. If you haven't had a virtual visit, I highly recommend you do. It is life-changing. The demand of today's world, not only in COVID, but in normal times, the demand is to have digital, convenient access, personalized healthcare from one's own home. So you can do it at 3 o'clock in the morning on a Sunday, or you do it on your own time when it's convenient for you. So when I started talking with the folks at Teladoc, they stepped right up. I asked them for now Teladoc is not, let me back up a second. All of the things I'm going to talk about from now on through the end of this webinar have absolutely zero to do with United Healthcare or health benefits, medical benefits, any benefits. These are all completely standalone solutions that you can choose to get one of or 3 of or none of. But they have nothing to do with, you do not have to buy health benefits to get access to any of these products. And that was sort of my point in looking for solutions that will work for part-timers, for full-timers that don't have medical benefits, for all of the millions of furloughed employees, uninsured, all of those people out there, 95% or so of the industry that doesn't have access to health. So that's where my attention has turned and in developing these new solutions. So Teladoc is amazing. It's available to absolutely everyone. There are no requirements. You can work 2 hours a week or 50 hours a week. You can be part-time, full-time, furloughed, have insurance, not have insurance. This is an incredible offering and gift from Teladoc to hospitality. So what this is, and as far as I'm concerned, everybody should have this. Everybody should have it. So this is $7 a month, and that includes an employee and that employee's entire family. $7 a month, and that includes unlimited visits with no hidden fees, no co-payments, nothing hidden, unlimited visits for an employee and that employee's entire family. And that is both general medical, so this package includes general medical, dermatology, so importantly, mental health. And that's one thing that I insisted on when I was doing this deal with Teladoc, is we've got to have mental health help, and it's got nutrition help as well. So this is an incredible opportunity to give employees access to help when they don't have any. Your employees are not getting help. They're not going to the doctor because they don't have health insurance. This program will encourage them, will actually give them no excuse not to see a doctor, not follow up, not get a prescription. So these doctors at Teladoc are all licensed physicians, all practicing, and they can prescribe medications. So it's an absolutely phenomenal program. Employers, you sign up, your employees, you can do it on a monthly basis. All you do is tell them who's participating each month, and then they bill you one bill per month. So you sign up all your employees or any of your employees. Next slide, please. So this is really interesting, I think, the data for employers. So any employers who offer employer-sponsored benefits, whether it's self-funded or fully insured, if you offer benefits, then you are, by definition, concerned with your medical costs, escalating medical costs, and how do you keep them in check? How do you control them? Well, virtual visits, the data shows, is a phenomenal tool to reduce employers' medical costs. And so, why is this? How does this work? Well, your employees right now have shifts. They do shift work. They work odd hours. They're not. They don't easily have time to go to a clinic or an inexpensive, primary care doctor because their hours don't work. And so what this does is that causes your employees to overuse urgent care and emergency rooms. Data clearly shows that if employees can avoid ER and urgent care, that's going to drive medical costs down. Conversely, if they go to the emergency room or urgent care for something they don't need, that's going to drive up your claims costs and your premium costs. So access to virtual visits eliminates the vast majority of urgent care and emergency room visits. So, and there are no claims involved. So you as an employer, essentially, you're paying $7 for 1 month for an employee and a family, and that's never going to show up in your claims history. It's never going to contribute to any increase of cost. Conversely, it's going to decrease your costs. And so I find this data to be very interesting. The top 5 reasons employees visit the ER or urgent care: allergies, earache, sinusitis, urinary tract infections, bronchitis. Those are the top 5 reasons people go to the ER. And it shows you here the difference in cost. When you look at a urinary tract infection that costs about $9.50 for a claim in the emergency room, and for the virtual visit, it's $0. You have no claims, you have nothing that contributes to your increase in medical costs as an employer. And along the bottom here, you can see the savings employers have enjoyed by using this Teladoc program. It's crazy how much employers can save. So phenomenal program on every level, from an employer cost savings perspective, it's the right thing to do by giving people access to something they so desperately need. So it's just a phenomenal opportunity. Questions? Any questions before we move on past Teladoc?
You can type your questions in the Q&A section. It should be on your bottom right-hand side.
On mine?
On the participants.
Oh, okay. You're not looking.
Not you.
Okay. Feel free to ask questions anytime. Okay, let's go to the next slide, please. So one of the things that's really nice to use with the Teladoc program is our free prescription savings program. And so if I go to the doctor, I have a virtual visit, and I have a strep throat or whatever I might have, and I need an antibiotic called in. The antibiotic itself is not covered at all by Teladoc, but we've got this great pharmacy program which allows people to go online, download a card or download a coupon, take it to a pharmacy, first figure out where the medication is going to be least expensive and most convenient. Because the amazing thing is, you probably know this, but it's incredible that if you compare the prices of the exact same medication at 10 pharmacies around you, they're all going to probably be different, and some are going to be 50% more costly than others. So good to use the comparison tool on this website. It's just a nice compliment to the Teladoc program. And I want to emphasize about Teladoc. So anyone that's ever had to, so we're going to talk about mental health in a few minutes, but the fact that the mental health, unlimited mental health, is included in that $7 a month, this means that you've got your employees who so desperately need mental health support. There's no way in the world they're going to get it, because they're not going to pay $300 out of pocket for a psychiatrist, which they need if they need medication, or anything down the line. They can't afford that. They're never going to do it until you have all of these issues that are going unchecked and untreated because they don't have a way to seek treatment or get medication. With this Teladoc program, they could go to a psychiatrist 5 times a week, and it costs nothing more than $7 a month. There's no hidden cost. You can just be assured that your teams are getting the help they need and deserve. Did I see a question pop up? Nope, maybe not. Okay. So the other partnership that I've been working on, and I'm very pleased to offer, is that with Let's Get Checked. So next slide, please. This is, of course, for COVID-19. So so I partnered with Let's Get Checked, and I selected this organization because this is the only FDA authorized organization and solution that that houses or owns all aspects of the testing process, from the development of the test, the creation of the test in their own laboratory, to the distribution of the test, to the testing process, and then the analysis of the sample. It's all owned by under the same umbrella, which I really like, and they have a 99.8% accuracy. And actually, the 0.2 is actually not because they've even seen an inaccurate test result. It's just simply for statistical purposes. You have to add some sort of error, measure of error. So this we're very, very, very happy with this test, and so many hospitality businesses are using this as part of their how do we reopen safely, how do we stay open, because I'm sure either you've experienced this, or colleagues, peers who have, where you reopen, you put all this work into reopening, one of your employees gets COVID and you have to close for another 2 or 3 weeks. I know, especially in New Jersey, it's been a nightmare trying to get to open. The governor, this is one of the tools, along with Teladoc, keeping employees healthy so that they're able to come back to work and stay at work and stay healthy. And then this COVID-19 test it's at home, so it's FDA authorized for at home use. Employers can email my team, and we can get you these tests. It's a minimum of 20 tests to get the exclusive members only price of $107 per test. The $107 includes the test itself, the free UPS pickup, expedited shipping, lab results, and you get them back within 24 to 48 hours. So this is, as opposed to, I'm sure you've experienced this or heard others that have experienced this, when you go drive through a line to get a test and you have 3 people in your car. Each of you is going, each one of your tests is going to go to a completely different lab, completely different owner. One might get a test back in 3 weeks, one might get it back in 4 weeks, one might get it back in 10 days. This way, there's standardization. All test results are handled again by the same organization, close to perfect accuracy and fast. So, as I said, so many hospitality groups are using this as a way to just get back to work safely. And not only that, but instill consumer confidence in the safety of hospitality businesses, which is half the battle. We want people to know that restaurants are safe, hotels are safe, and this is a good way to show that. Next slide, please. Okay, so Let's Get Checked also, one slide, yeah, right there. Not only does Let's Get Checked provide us with COVID tests, but also makes available just a plethora of other non-COVID tests that are just for people's regular health, whether it's diabetes, Lyme disease, thyroid, hormones, colon, sexual health, cholesterol, all those things. Your employees can go on to the website on this slide, and they get a 25% discount on any non-COVID test. Now, the COVID test, you as an employer need to order that because they're, as you can imagine, they're in such high demand. They can't sell them just, for one individual. They need to sell them in bulk. Otherwise, they won't have time to. That's the only way I could get them to provide the hospitality industry with access by making it. The orders go through the employer and having a threshold of 20. This, on the other hand, if one of your employees is afraid he or she has Lyme disease, that person can go to this website and order a test delivered to the house, collect the sample, again, free UPS delivery, and the results come back in about 2 days online in a portal. So I've tested multiple of these tests myself, and they're super easy, and I personally love them. And the ability to stay out of labs. Personally, I will reduce the number of times I have to go into a medical office. If I don't ever have to do that again and do it all at home, I'm all in. Next slide, please. So Kaya is another one of my partners, and Kaya is actually a phenomenal artificial intelligence, musculoskeletal, physical therapy app, and it's really amazing. If you think about your employees who, and obviously hospitality lends itself to musculoskeletal disorders with the spine, the back, the feet, everything. And if you think about those employees who really truly need physical therapy, and they're never going to get it for reasons similar to why they don't go to the doctor or why they go to the ER instead of a more appropriate level of care, they don't have time. They don't work traditional schedules. And as well, anyone that's ever gone to physical therapy, you go and they want you to come back 3 times a week for 6 months. And who can do that? Who can do that from a schedule perspective and from a cost perspective? It's prohibitive. And then insurance cuts you off at, you're allowed to have 8 visits and then you're done. For whatever reason, there are barriers, people getting the appropriate physical therapy care that they need. So this company, anyway, it's very, very cool, artificial intelligence. They approach physical therapy from a very holistic perspective, including education, pain management, the whole body and mind, not only the physical aspect. And so it's a really phenomenal program. So what Kaya leaders have done, and I'm so proud to be partnered with them. So they have offered us free access to their virtual back pain program. And this is for anyone anyone on this phone, any one of your employees, go to this link, they sign up, they get free access to this back pain program, which is incredible. So anyone who has back pain, go check this out, look it up. You can do it on your own time. You can do it in the middle of the night. You can do it first thing in the morning. You don't have to go to physical therapy. And let's face it, those who have painful issues, if they don't get help, if they don't get the mitigating physical therapy kind of structural help, that's going to escalate. It's going to escalate into some bad stuff, whether it's addictive painkillers, whether it's surgery, whether it's significant time off work. It's never good. So again, completely free. You can go look at a video. You can go log on to the link you have here. Next slide, please. Just kind of shows you how amazing this organization is. And the data for people who use Kaya is just amazing in terms of physical improvement, in terms of psychological, mental improvement, mental empowerment, because anyone who's experienced pain knows that it's debilitating. When you have pain, chronic pain, it very often leads to depression, a lot of other substance use disorder, etc. So cannot recommend this enough. Again, free. Next slide, please. This kind of shows you the holistic approach that Kaya takes. So I absolutely love it. The leaders are phenomenal. I'm so grateful and impressed that they've offered this service for free. Okay, next slide. Okay, so getting back to mental health, substance use disorder, suicide prevention. So the reality of this challenge in hospitality is that it's very real. And starting a couple years ago, I started to really have my friends in the hospitality industry, owners, operators, my association partners, they all started asking me for mental health support, substance use support, and came to me with a very serious and sincere concern about the suicide escalation in the industry. And so I started working on this about a year and a half ago, before COVID, and started to establish some partnerships with some phenomenal organizations. And the thing we have to really realize now, this project for me has become entirely different now because of COVID, of course. So not only is it incredibly urgent and critical for us to talk about this now and to have solutions and pass them along to our employees, but it's COVID with the isolation and the hopelessness and the unbelievable stress and depression, and it's a bad time for people from a mental health perspective. One of the things that not everyone realizes is that it affects every single one of us. So I've been listening to a lot of health experts lately talk about how pervasive the problem is throughout our communities, throughout our country, throughout our world, and really the fact that if anyone's been alive for the past 9 months, you're probably a little stressed out. You might even be struggling with a little depression, anxiety. There really isn't anyone who this hasn't touched from the perspective of having abnormally high and dangerously high levels of adrenaline in our system, cortisol in our system, that we shouldn't have, simply because of, my gosh, everything we've been bombarded with over the past 9 months. And all of that, this is evidence. This isn't conjecture. This is evidence that this type of high level of adrenaline and cortisol leads to a compromised immunity, both physiologically, physically, and psychologically. So the very real and basic result here is that we are all less capable now. We're a little bit, we're compromised. We're less capable of fighting over common cold, fighting common cold, fighting the flu, any other illnesses. We're not quite as strong as we were a year ago. And that goes the same for mental health issues. We're worn out, we're exhausted. And so as this COVID comes, resurges, or hasn't stopped surging, but as the next wave, as we're anticipating the next wave, we're not going to be as able to fight it off unless we really, really work on it and take care of ourselves. And that goes for our employees too. We've got to give them the help they need. And so number one, everybody, please get your flu shot now. October is the month. Flu is upon us. Experts recommend that you get it in October. Please, please, please get your flu shot. It protects you. It protects everybody else. It protects the healthcare system from being compromised. So please do that. You can get them free anywhere. Next slide, please. So in the course of the past year, I've put together some resources that I hope you pass on to your employees. These are all free. The first one is, so I partnered with Active Minds, which is a national nonprofit focused on mental health and suicide prevention. I partnered with them about a year ago and underwrote a study based entirely on hospitality. And so we did surveys, focus groups, and we've got some amazing data on what are the drivers of the hospitality industry that lead to escalated mental health issues, substance use disorder, suicide, et cetera. So we've got some amazing data, very interesting data. Some of it really surprised me. Anyway, we're very close. We're probably weeks away from coming out with the information that we'll make available to everyone. So employers are able to understand their employees better and to create a safer place where people feel like they're not suffering alone. That's the idea. So many people out there are suffering right now. We don't want them to suffer alone. And so all of these resources are free. Every single one of them is free, and they're so worth looking into. So San Bello and Patients Like Me, we're going to talk about in a minute. Ben's Friends, I'm sure a lot of you have heard of Ben's Friends, phenomenal organization. These guys who started this about 20 years ago. They have in-person meetings in various places all over the country, and now they have a weekly call-in, for people who need support from people who understand them and their specific challenges. Next slide, please. Then we have a variety of crisis lines. If you want to call, if you've got a substance use issue or your family member does, you can call the substance use disorder hotline. Talk to anybody. They'll help you. They'll help you with next steps for yourself or for a family member. Also, just an emotional support helpline. They've made it free for us. So pass it along. We have resources. We don't want people sitting at home and suffering alone, feeling isolated. And then getting back to Teladoc, this is the only one that I couldn't get for free, but it's as close to free as I could get it. It's $7 a month. But again, I want to underscore the fact that this is an amazing mental health resource for you, for your employees. Unlimited visits every month with a mental health professional. And by the way, you can go back to the same one. I had an appointment for something. I had an infected wasp bite, And so I had about a month ago, so I had a virtual visit, and she wanted to see me back again 2 days later. And so I could go in, select the same practitioner, and saw her 2 days later. So she could check in on me, look at my hand, compare the pictures, etc. So if it's a general medical visit, or if it's a mental health visit, you can see the same person repeatedly if you like. Next slide, please. So I want to talk about two of the mental health resources a little bit more in depth, because I think they're so fantastic. And they're free again. So Patients Like Me it's the world's largest personalized health network. And so it's a place to go if you go on, you create a profile. It's almost like a social media platform for health, symptoms, conditions, medications, things like that, treatments. And so you go in and there's so the nice thing they've done for us, the owners of Patients Like Me, they stood up a hospitality specific page, so you can send your employees or go yourself to the hospitality page, where we have also listed other mental health solutions, so people can have kind of a one-stop shop for what they need. But anyway, it's really cool. People go on to this platform. They can connect with people who are similarly situated, whether it's a community of people that have heart disease or diabetes or suffer from depression or substance abuse, or their child has asthma, or someone just broke a leg. Regardless of what it is, there are thousands and thousands of people out there who are in the same situation. And this is an amazing opportunity for people to learn from each other, have questions answered about conditions and symptoms for a child or a loved one. Anyone who's ever had young children knows that they get really weird things, and parents have no idea what to make of them. You don't know, do I need to run to the ER, or is this something that's going to be fine in 5 minutes and my child stops crying? So, you hop on to Patients Like Me, you ask questions. Chances are you're going to have 1,000 people that said, oh yeah, my child just had the same thing and it's blah, blah, blah. So it's a really great program, and the data shows that it absolutely improves lives, improves outcomes, and so I love it. I think it's a phenomenal opportunity for people to feel connected, especially now when people are so isolated. Next slide, please. This is the other one that we really love, Sanvello. So Sanvello is the global leader in an app that combats anxiety, stress, depression. We love this. My team absolutely loves this. We all use it every day. It's free, and what they did for us is they stood up a hospitality page for us, which is so incredibly generous. So it's an app that's set up using the precepts of cognitive behavioral therapy, designed by psychiatrists, psychologists. It's a phenomenal resource. Again, free, helps people through their day, helps people to feel better, get better. Just so many tools to help people be resilient. So again, I highly recommend just passing this along to anyone you know. The more people we can help, the better, as far as I'm concerned. Next slide, please. And that's it. So there you've got Amy Hathaway's information, and you've got my information. And what questions do you have for us?
I did
No questions?
no questions at this moment. I do want to let you know we have been pushing all the mental health items that you've had available since back in March April um, when you started building the arsenal of mental health tools for our industry. Oh, we have a question. Yay. Will the slides, I know we get excited over questions. Will the slides be available so we can copy and paste the URLs and share with the employees? Yes, this video will be available, and we can definitely send you all the URLs so you can make it available for your employees, because employees are very important. They're key to our businesses.
What else? Any other questions?
No, that
Okay.
was the only one.
If you find that you have questions at all, just always feel free to reach out to Amy. Feel free to reach out to me, and we will help you the best we can.
Yes. As always, thank you, Kimberly, and thank you, guests, for tuning in, and have a wonderful day.
Thanks, everybody. Thanks, John. Take care.
You too.